A second opinion is very important in many cases, and the reason is that you might not be getting the progress that you're expecting to make. And if you're not making progress, a second opinion, or if the diagnosis doesn't seem correct to you when you first get it, like you come in and you see a practitioner and they tell you what you have, and you go, I don't know, because many things have a lot of different causes or potential causes. And for example, if a person comes in and they get a diagnosis of some kind of mental illness, but there could be some medical condition behind that, and oftentimes those people aren't properly diagnosed. They're just given a label, right? Well, a label is a label, but what's more important is how do you treat it and the correct way of treating it. So blood tests, MRIs, other diagnostic tests, x-rays, whatever it might be causing some of those underlying conditions. It could be nutritional problems, allergy issues, and a common one that we run into, and something I spend a lot of time working with, is traumatic brain injury. Traumatic brain injury is a concussion. Now they call it mild traumatic brain injury. It's like after an auto accident. Statistically, 23% of the people who are in an auto accident where a whiplash occurs actually have some degree of mild traumatic brain injury. And it can cause all kinds of symptoms that mimic mental conditions. And that can be dizziness, confusion, forgetfulness, and this can linger for quite some time. Especially in an aging individual, that person might not get diagnosed properly because, well, they're aging, they're getting, they're in a point where they might be forgetting things anyway, but it would be accelerated by that accident. People may not notice it, and they think, well, he's just a little bit older, so therefore he's forgetting things, he's not remembering his keys, he's forgetting things on the stove, whatever it might be. That could be a traumatic brain injury. But it's also true in young people. If they've hit their head and haven't had the proper evaluation and treatment, they might exhibit signs that would restlessness, anxiety, difficulty with attention. They might be getting upset more easily, more anger, and that can be caused from a traumatic brain injury as well. But again, because traumatic brain injury is a concussion, and they don't have to have hit their head in order to have a brain injury. Okay, the brain floats inside the skull. So if their head is thrown forward in an accident in a car or just playing in a playground and they stop it very quickly, the brain keeps moving inside the skull. And when it keeps moving and the skull stops, it can bounce off the walls of the skull. And that's a condition called contre-coup, which is French for blow, counter-blow, whereas the brain essentially sloshes or bounces around inside the skull. And that causes bruising and can cause injury, in some cases permanent injury to the brain. So it's very important to get a second opinion. And if there's any suspicion of any of those kinds of conditions, and there's been any head injury or bodily injury at all, even if the head didn't strike anything, find a neurologist in particular, and get a good evaluation done with an EEG and maybe some MRIs, x-rays, whatever, blood tests, and find out what's going on with that. And that kind of leads into additional things that can happen, which is a person who's exhibiting some of those symptoms that could be considered mental conditions, like anxiety or anger or whatever it might be, difficulty sleeping. Those can come from nutritional deficiencies. They can come from other allergies, nutritional allergies, airborne allergies, whatever they might be. And it's important to get those diagnosed because many times things calm down once you get the right treatment going, and fairly quickly. So especially if people aren't getting changes in their health condition or it's getting worse, then they definitely should get a second opinion and find out really what's going on. So it's an important part of second opinions.